American Academy of Pediatrics is releasing new guidelines for physicians as nearly 1 in 5 children under the age of 18 suffer from obesity. Medications and weight loss surgery are now being more strongly considered as many physicians say lifestyle changes like diet and exercise just are not enough. We asked an expert from St. Louis Children's Hospital about the new guidelines.
We encounter more and more kids who have very high weights and have comorbidities or complications from their high weights like diabetes or high blood pressure or sleep apnea. And in those kids, lifestyle alone is maybe not adequate to treat them. And so giving us these other tools like medication or thinking about surgery are good additions to our treatment planning.
Dr. Sprague says the causes of obesity are complex, extending far beyond the lack of diet and exercise. The new guidance outlines gastric sleeves or gastric bypass surgeries for children as young as 13. She says Children's Hospital has performed the surgery on children only as young as 15.
It's not a quick, you come into clinic, say you want weight loss surgery, and you get that scheduled a week later. It's at least 6 months of working with us on behavioral modification and a really extensive workup, working with a lot of people before you get approval.
The new guidelines are also encouraging early intervention, citing case studies showing that many children with obesity grow up to be adults with obesity rather than growing out of it.